Action.
Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're doing well. Today, we're going to chat about some interesting stuff, as usual, as I've promised. We'll talk about exercise and get into the science of exercise and how it helps your immune system, how it helps all sorts of areas of your body. We'll also talk about some new research on CoQ10, how it's important for fertility, heart function, immune function, energy, a lot of things that people don't realize. So in so many cases, people hear about taking vitamins and think, well, I'll just take a multi. I'll take this, I'll take that. Or someone showed me an interesting ad on TV and I'll just take that and see what happens. And most people don't feel anything from randomly taking vitamins, in part because you're not getting your vitamins to the right level in your bloodstream and to your cells to make a difference. That's why we always talk about blood tests for vitamins. The big blood test we do, of course, always looks at vitamins, minerals, hormones, multiple combinations of things, immune response, free radical exposure, heavy metal exposure. So we're really learning everything about your body and then putting together that perfect complement of nutrients. Then to go one step further, we're looking at retesting your deficient vitamin levels to prove you're in the perfect range and watch to see a variety of different things improve. So when we talk about CoQ10, it's one of the most important nutrients you could have on board, and it plays a role in just about every single mechanism or chemical reaction in your body. Of course, CoQ10 is intimately involved in how you take oxygen and convert that into energy, 36 molecules of ATP. And studies talk about oxidative stress, where free radicals can damage your tissues and cause oxidation. So oxidation is the loss of an electron. If a free radical grabs an electron from tissue, it causes damage. That's oxidation. Antioxidant vitamins block that from happening so the cell isn't damaged. Enough free radicals damage the cell, the cell will become destroyed. It's called apoptosis. So important to understand that you need to have all these nutrients on board for great function. So that's why the most important blood test that we've done over all these years is the blood test for vitamins and minerals. Some great research on CoQ10 and fertility. This is a study in 2018, women who had taken CoQ10 had significant increase in pregnancy rates compared to similar women and those women beforehand who are having difficulty getting pregnant. And in men, 30 to 80% of men have free radical damage occurring, so they have a harder time making enough sperm to be able to create conception. But taking CoQ10 supplements made a very big difference in that count. So important to consider that. We talk about CoQ10 creating energy, the antioxidant benefits in heart failure. We know that CoQ10 is important for contraction of the heart. And those people who have low levels of CoQ10, the heart is not going to contract and have strength in its ability to pump blood throughout your body. And in those people who took CoQ10, significant improvements are seen in their ejection fraction, which is that contraction that sends the blood out. It also can help lower blood pressure by up to 17 millimeters of mercury on the blood pressure cuff. And to some extent, it helps to lower cholesterol. So there are many, many benefits for CoQ10. We were talking the other day about vitamin C, and then we can talk about D and E and beta-carotene, and we can do each of the vitamins individually, and that might be a fun thing to do so that people can gather more information on it.
Yeah, real quick, people in the chat are asking, can you explain free radical damage? People are confused.
So important concept. Free radicals are things that circulate in our bodies all the time. And to have an easier understanding of free radicals, if you get a sunburn, the damage from the sun, the rays of the sunlight, damage your skin. That's free radical damage, and that causes the burn. Putting on something to block that damage prevents the free radical damage. In another way, if we talk about smokers, people smoking, and there are typically 4,000 chemicals in cigarette smoke, when those harsh particles hit your lungs, they're damaging the lungs. To make a little bit of a visual of this is a brick wall over here, and I'm a free radical, and I steal a brick from that wall, I'm damaging that wall. If thousands and millions of free radicals start to damage and take bricks out of the wall, then you're causing destruction of that cell, which is called apoptosis. So if we're taking 100 bricks, 1,000 bricks, that membrane is not going to stay strong and keep the bad things out. And then leakage occurs, and now more bad things get inside the cell to damage mitochondria, ribosomes, Golgi apparatus, all of that. So the cell dies. So the easiest way to think of free radicals is like taking bricks off of a wall. So if I'm here, I'm going to take bricks off of the wall, then something completely blocks my ability to do that and binds to me. I can't do it. That's an antioxidant, like vitamin C, like CoQ10, like any of the great nutrients we talk about. So that's how free radical damage destroys tissue. Free radical damage also occurs in the lining of your blood vessels. I mean, it occurs in every part of your body, in your brain. And people who develop brain disorders, Alzheimer's, Parkinson's, all of these things, MS, these things are caused by significant free radical damage. So that's what we want to stop. And nutrients can help to do that, prevent that. For some people that do intravenous vitamin therapy, it's an amazing way to stop free radicals and shut down inflammation, make your immune system strong. So each of the degenerative disorders that occur in our body and the autoimmune disorders and normal aging occurs from free radical damage. So important to understand that and to work, constantly to try to prevent that from, creating progression of disease. That's why we talk about taking vitamins every day, because you want to stop a lot of these things that we're exposed to and stop the degeneration that occurs to all of our tissues as a result of free radical damage. So, important concept. In a perfect world, if we can get all the best vitamins on board, which we do, based upon your blood test for your needs, your individual needs, depending upon your age, your absorptive ability, your exercise. And if we can get the exercise on board to flush out free radicals and to enhance function and get rid of waste products of metabolism and have more oxygen come in and make cells work better, and we'll go over that in a minute, then that's the ideal. That's perfect. So some interesting articles on exercise and immunity. And, of course, we're going to take your calls here in just a few minutes at 888-420-9272, 888-420-9272. We'll get you up on the air. Exercise helps your immune response in a variety of ways. Exercise causes increases in antibodies and white blood cells to help fight things. And obviously, exercise is delivering all of these great immune cells all over your body. So a person who's stationary and doesn't do activity, you're not getting the delivery. You're also not getting delivery of vitamins and minerals and hormones to all the cells that need it. So you're feeding your cells their food, which are vitamins and minerals, by doing the exercise and flooding your cells with oxygen. So the exercise is beneficial in many, many ways. You can help flush bacteria out of the lungs and the airways, reducing the chance of getting a cold or illness. A brief rise in body temperature during exercise and right after helps to prevent bacteria from growing. And this is from Medline, reputable journals. It slows down the release of stress hormones. So a variety of benefits. And typically, as the research says, and I've been saying this for the better part of 30-some-odd years, 38 years, you want to do at least a half hour of activity every day. Now, one day you might want to do an indoor bike, another day outdoor bike if the weather permits, or go for a walk around the block. My favorite comment is for those people who don't or aren't that motivated, just walk corner to corner around your block. Walk to the first corner comfortably, stretch out, then make a right or a left, go to your next corner, go a little faster. So slow, brisk, fast, slow, brisk, fast. Keep doing that. And then at some point you can get to do slow, brisk, fast, and keep the pace up. And varying the pace is great for your body as well. So when you do that for a half hour, you get all these benefits. If you do it for 45 minutes, it's even more. Do it for an hour, it's wonderful. Now, of course, people that have joint issues or other medical conditions, you have to be careful. Sometimes you do it slower. Sometimes you do it less time overall. But as you start to create your body's response and you create stamina and endurance and strength, and your blood vessels now can easily open to accept that blood flow that the exercise requires. You're training your blood vessels to be open and to open more quickly. So that helps with your blood pressure. And all your cells getting wonderful oxygen, vitamins, and minerals and hormones is a terrific thing. So this is why we talk about that specific exercise. There are some people who love yoga and Pilates. That's great. Some people love to run. I just caution runners that you have to be careful of your feet, your ankles, your knees, your hips. I've had patients that were training for the marathon and broke a little bone in their foot. Sometimes that activity is a little bit too much for what their body can handle. Of course, if you're 15 to 20 years old, you can take on the world and do anything and everything. But, as you get a little bit older, you have to be more judicious. You can't go full on and go full crazy. So all of those things you get from exercise and correcting your nutrients. And I think I'll do, each time we do a podcast here, I'll talk about individual nutrients so people can hear about it and, learn about the research. Once again, phone lines are open, 888-420-9272 if you'd like to call in to ask a question, 888-420-9272.
Instagrammers are already...
Alrighty, they're here.
They're chatting.
It might be our favorite group.
Oh.
Instagrammers are coming on strong.
Yeah, YouTube's a close second.
TikTokers, I don't know if they're up yet. This might be a little bit early for them. I don't know. I like being a little provocative.
Yeah,
Let's get some TikTokers, okay? So and YouTubers so we can balance it out.
I love it.
So yes, Instagrammers.
We have, so is there a natural remedy to fixing eye floaters?
There's no natural nutrient or supplement that's going to take some degeneration on the lining of the retina and make that go away. I will say that nutrients are important for your eyes as well, lutein, zeaxanthin. So we talk about using quercetin, bioflavonoids, but as you get older and that membrane starts to wear down, it may be because you're not getting enough good blood flow there. We talk about doing exercise, and that can help dilate blood vessels, including every part of your body. And separately, I talk about using stem cell therapy to help to repair damage to the retina. Now, we've seen this before in patients that are diabetic that have diabetic retinopathy. When the retina is damaged by the excess sugar in your blood and damaging your cells, and when the blood flow is decreased and you're not getting a lot of good, warm, oxygenated blood with all the good things in it, you can start to see the membrane break down. Macular degeneration is a similar circumstance where, like a plant in the garden is not getting enough water, it's not getting enough minerals, and healthy fertilizer to the plant, then the plant's not going to grow well. Same thing with your eyes. You need all of these things getting there. In doing stem cell therapy for diabetics and for people that have macula and people that have had stroke, MS, Parkinson's, Alzheimer's, when we do the nasal droplet, when people are laying down on their back after the IV for the stem, you're dripping those cells into the back of the nasal cavity, gets into your bloodstream, goes into the brain, and you see benefits with all those areas. So some people have a significant decrease in the defect of macular degeneration. Their vision improves. And we've seen that. There are videos on the website specific to that. And the same with diabetic retinopathy. So in a perfect world, in my mind, I think we've got to correct vitamins, minerals, hormones, exercise. And if we put your own and your best healing cells there, you can get significant benefit to the retina. Good question.
Love it. And then I saw on your website that you offer IV vitamin therapy. How often is that recommended, and why is it better than daily vitamin capsules or pills?
Great double question. So intravenous is 100% absorbed. That means that whatever we put into the IV goes right into your bloodstream and is now available to all of your cells. With oral supplements, nobody absorbs 100%. Maybe young children who have a great gut and nothing's affected it yet, but even then, you can't expect someone to take 8 to 10 or 12 or 15 or more thousand milligrams of vitamin C. You couldn't do that without having the side effect of sometimes a loose bowel movement. So intravenous access is 100%. You could use larger doses. Ton of research on vitamin C IVs. And every day I talk about vitamin C IVs. I tell people to get on Google Scholar and look at putting the intravenous vitamin C therapy into the search box And you'll see at least 1,300,000, 400,000, 500,000 studies on intravenous vitamin C helping to inhibit cancer, being used as a secondary therapy with other cancer modalities with great results, helping to inhibit and kill viruses. So the list goes on and on. It's great for quadrupling your killer cells to fight things. It's great to shut down inflammation, sepsis. I think we spoke last week a little bit about research on vitamin C, but it's there. And I tell everybody you should start, scrutinizing, looking at literature, go online, look for some of this stuff because it's there. I tell everybody about that. So you're getting 100% absorption with IV, and you have greater results because you're keeping your levels of those nutrients higher. If I were to make a side comment, some medications, older antibiotics, you had to take 3 or 4 of them a day to maintain good blood levels of that to kill an infection. And the newer antibiotics, 1 a day, because they last longer with good effective blood levels. Some antibiotics like Z-Pak, zithromycin, you only take for 4 days because it's got a great kill effect in a shorter period of time. Older antibiotics had to be 3 or 4 times a day for a week, 2 weeks, So there are differences. And when you look at the intravenous therapy and you're making more killer cells, and if you do the intravenous therapy once a week for a few weeks, quadrupling your killer cells will last longer in your body. When you take an antibiotic and it's done, nothing has changed with your body. It hasn't given you anything, but it helps to kill a bug, hopefully. And the IVs give you huge levels of killer cells, macrophages, etc., and that lasts over a period of time. So much so that in the many years that I've been doing this, we've had people come in that have a flu, a cough, a cold, a virus, and in doing some of the vitamin IVs, they report that they don't get those colds anymore. As well, some of these individuals will come in once or twice a month in the winter and say, I don't get that cold anymore. I used to get sick every November, every December, or every September. And putting these things in place, people don't get the infections like they used to. So it's a pretty significant, part of the population of my patients. It depends upon what we're working with. A person who's really sick may need to do them once or twice a week for a few weeks. Other people do them once a week for 4 weeks, and they feel great. And then down the road, we kind of have a little bit of a suggestion for patients that if you start to feel sick, give us a call. We'll get you back in to do the IV because we want to see if we could knock it out before it becomes significant. So kind of a standing order. Great question.
All right, we got it. We're back to the eyes. Same guy. He said, I paid extra for glasses that filter out blue light from screens. Is this beneficial or BS?
No, it's a good idea. You want to be very careful if you're sitting in front of a screen all day long. So filtering out what could be harmful rays getting into your eyes makes sense. That's like sunglasses. Sunglasses have been around forever, but only relatively recently in the history of sunglasses have we realized that you don't want to get a dark plastic glass without UV block. Because think of it, if you wear sunglasses without the UV block, you're opening up your pupils so more of those rays can get into your eye and affect or hurt your retina or your lens. But if you have the UV block, you're blocking those rays, your pupil opens up, but now you're blocking the bad rays from getting into your eyes. Wow. So that's why you want to have the polarized or the 100% UV blocking sunglasses.
Well, that's good to know.
Yeah, very important. People don't realize it, but you want to protect your eyes as much as possible.
Wow. We got another one, YouTube.
Awesome.
I'm a 30-year-old male trying to lose weight. I have a busy schedule, so regular exercise has been challenging, but I'm working on improving that. I used to follow a higher carb diet and recently heard about the intermittent fasting. Is it better for my metabolism and weight loss to eat portioned, high-protein meals throughout the day, or is intermittent fasting more effective? I'm concerned about my metabolism stalling.
So we're covering a lot of different questions, a lot of ground there. The best way to lose weight revolves around a couple of very simple ideas. If you decrease carbohydrates in your diet, your body has the ability to reach the fat to burn it more as a primary fuel. Every diet out there that works, and for a very long time, it's been a low-carb diet. So cutting back on the carbs, getting rid of bread, rice, pasta, potatoes, oatmeal, grains, all the higher starch and carb foods. Get rid of fruit. You could have berries. Will typically help because that sugar intake decreases, triglycerides go down, cholesterol goes down, and your body, in a way, says, okay, there's no sugar or starch here. I'm going to burn fat as a primary fuel. And you see that happen right away because triglycerides plummet within a day or so. If you add on top of that exercise, and it could be a half hour of walking in the morning before you go to work. Some people will take a break for lunch and will go do a bit of a walk. Other people do it when they get home. If you have a hard time doing the exercise, that may make it a little bit tougher. But if your hormones decline, like thyroid, DHEA, testosterone, IGF-1, the active component of growth hormone, and this happens as you get older, you want to correct those because then your fat-burning ability becomes, wonderful again. And if your vitamin levels are low, you want to correct those. And that's typically how we start. And I've done that, exclusively on many years for patients with great result. Some people still, in doing that, have a hard time getting over the hump. And for some of those people, we may opt to use the weekly injectables, like semaglutide or tirzepatide. I don't use those as a long-term drug. I use those over the course of a couple of months to get them started. And as you start to lose the weight and your appetite decreases, but you continue low-carb, exercise, corrected hormones, etc., then your body will work beautifully and you'll get more weight loss than the people just doing the injectables and not the others. So I think it becomes a good lifestyle idea to keep the carbs down and always have the exercise, etc., on board. For those individuals who are doing intermittent fasting, it does work. You're telling your body there's not much coming in, so it starts to burn whatever sugar you have and some of the fat stores. So people do lose weight on the intermittent fasting. My only comment is I don't want you to be deficient in vitamins because vitamin deficiency makes your immune system weak, can affect your hair, your skin, your nails. So we give people the option. If they want to do the intermittent fasting and not eat anything for breakfast and then start eating at 1 o'clock in the afternoon till 4 or 5 o'clock and then not eat beyond that, or some people will eat 2 o'clock to 6, you can do that. But as long as you're taking your vitamins within that time and you're keeping your carbs down and you're doing the exercise, then you get your best results. So if you do 4 things, you get great results. 1 thing, not really. 2 things, not really. And I have a lot of people who are doing 3 of the things, but not doing the exercise. So they might be right on the cusp of getting the result. And when they start kicking up the exercise, the results come. So on one hand, I say everybody's different, everybody's individual. But on the other hand, I see a lot of people that are in the same realm, but just aren't doing enough of that exercise. So turn up the exercise, turn down the carbs, and you get your result. Probably about 30% of people I see that want to lose weight, it's just a little bit more exercise and a little bit less carbs. And maybe fine-tuning the thyroid or the testosterone or the IGF-1 levels. So it's a little bit of fine-tuning that gets the result.
Well, I'm learning a lot right here. I felt targeted with that question almost.
Well, you can speak to 1,000 people, and everybody has some episodes of fatigue. Everybody has some episodes of being achy, and they don't want to get up and go and do. And, the older we get, the more difficult it is because your body's changing. Aging is just loss of your hormones and your neurotransmitters. So now your body can't do what it did a few years back. And, for some people it's mysterious, but it's not that unusual. And shouldn't be that much of a surprise. Because I can tell you with thousands and thousands of patients I've seen over 38 or so years. I got my medical degree in 86, went into my internship residency, learned everything I possibly could, took 1 million courses, and became fluent in all of this. If you look at a person and they have a variety of problems, whether it's overweight, high sugar, diabetes, high cholesterol, all of these things, age-related things, and you walk them back to where they were 10 or 15 or 20 years ago when they had great vitamin levels and great hormone levels and had the energy and the desire with those great hormones to do the exercise, and we're doing it, you just go back to where you were. You'll be a younger version of whatever age you are now, and you still will look a little bit older than you were, but you'll function beautifully.
We got a YouTuber.
All righty, another YouTuber.
He said, I saw that you helped a veteran with PTSD using stem cell therapy. This might be a bit of a stretch, but can stem cell therapy help with all forms of PTSD, including emotional or psychological trauma, or is it mainly beneficial for PTSD related to physical injuries?
I think that it will work because we've done this on other patients that have had significant, traumatic episodes. It doesn't have to be traumatic brain injury like the gentleman who's the veteran. We have patients that have had significant cluster headaches with spectacular results and no headaches. We have people with anxiety and depression that have significant improvement. So let's think of this mechanism. Your brain makes chemicals, neurotransmitters, and in different circumstances, those neurotransmitters decrease. In some people, it's aging. In some people, it's Parkinson's or Alzheimer's or MS, and you're not making the neurotransmitters to connect the electrical transmission from neuron to neuron. Other people, of course, have an injury where the brain is sort of rattled in their skull from being blown up in a vehicle. That's the ultimate decrease in production of neurotransmitters. Some people have that decline because their other hormones have been declining over time. So there are a lot of different variables. But the one true mechanism of putting your own cells on board to have new brain cells that make the neurotransmitters makes a world of difference. To have that mechanism put new cells into your pancreas, so now you have new cells that are pancreatic cells, because stem cells become those tissues. Making insulin brings your sugar down. So I think there's always a benefit to putting brand new cells into areas that either have a slow or rapid decline and degeneration of cellular and chemical and neurotransmitter function. Not to mention that a lot of people that have PTSD and have anxiety and panic disorders either will have a decline of their thyroid hormone, DHEA, testosterone, estrogen, progesterone. We test that right off the bat in the first visit. A lot of people as well, because we're living in this super carb world and have been for many years, are training their bodies to make more insulin every time they eat carb or big carb meals. And now your insulin production and release is so much higher than it needs to be. It's forcing your sugar down too low, which absolutely causes panic, anxiety, depression, irritability. The list goes on and on. So in my world, we would look at all of those things right off the bat, talk about diet and exercise, and then put this all together. So it's best answered by looking at a combined comprehensive picture than just looking at a medication to try to blanket or to decrease a patient's sensation for their symptom. And you could look at the video with the gentleman here, that veteran. Josh is a wonderful guy. I speak to him every couple of days. And we're doing a wonderful project together, which I'll explain in a minute. He went through hell, blown up in a vehicle, and then he went to every VA facility to try to do whatever, drugs, this, that, the other thing, and nothing worked until new cells were put in to create brand new brain cells, get rid of his headaches, his pain, neck pain, memory focus, concentration, everything came back. And he was as bad as it can be, when we first saw him. And similarly with Tom, the gentleman from Nova Scotia, with his cluster headaches. They implanted things in his head. I mean, it was just a huge combination of things that were done that, in my mind, really couldn't have worked, but they did them anyway because he wanted to do them because he thought there'd be some benefit from it. But if you talk to him now and you see our video with him now, he is 1,000,000% functional. He hasn't had a headache or an issue in as many years as we've treated him, and maybe 5.5 or 6 years. And his headaches went away within that day of treatment. another lovely young lady, Andrea from Louisiana. I think she's down in New Orleans, one of my favorite places to go for a vacation and have some good food. The same day we did stem cells, and she spoke to Tom because they're in a group of headache, chat group. She came and she did it. I spoke to her on the phone the other day. It was overwhelming for me because, and this was just a couple of weeks, maybe a month out. She said, this changed my life. She says, I've had no headaches. I feel great. I'm energetic. I want to get up and go. I take my kids and she's going on. And I'm, talking with her. And obviously I have my iPad Pro connected because I want to be able to document everything she's saying. But we spoke for a while and she's got a spectacular outcome. And I'll have her here on the podcast. So within the next week or two, she's dying to do it because she's feeling so well. So,
and just to add to that, the gentleman who had the crazy cluster headaches that you had helped, he had also listened to other doctors before meeting you, and they convinced him to literally get these basically metal bars put into his brain. So not only did the therapy help his cluster headaches itself that other operation didn't, but that other operation caused so many other issues that also kind of were fixed as well.
It's a shame because, traditional medicine, I think, and I don't know much about traditional medicine in Canada, or the fact that you can't get anything done, in a relatively short period of time because I have friends up there. They're using all sorts of different things, but nothing that's really focusing on the cause of the problem. Like for a diabetic, you can give them tons of drugs and shots, and that's what's typically done everywhere in the world. Why not just take your own cells, do the IV, and let your pancreas become younger by putting new cells into your pancreas that make insulin? It's the easiest concept to understand. But, things are different in different circumstances. I'd much rather use something as healthy, as natural as that and get the result, by the way. So,
right. We have a follow-up question on the stem cells. Can stem cell therapy help with addiction? If so, how does it work?
I think in a similar fashion, helping to make, brand new neurotransmitters can make a big difference in how you feel and how you think. And again, I can't answer 1,000,000% on every possible, mechanism. But I think repairing the way that your brain works makes a very big difference because addiction is in great part a brain-related dysfunction. You're not making your neurotransmitters. Some people that happens from exposure to drugs or medications. For some people it happens with injury. Some people it happens with heavy metal exposure. So we have to look at the entire picture. I always think putting brand new cells, your own cells in your body, they shut down the inflammatory cascade and will go to every area of damage and make brand new cells makes all the sense of the world. There's no negative side to it. No side effect, no drawback. They're your cells. They speak the language of the rest of your cells. So I'll get on today when I get back home. I'll get on and look at stem cell therapy for addiction, look at the research, as I do every day. Because sooner or later, patients will ask, I have a cousin with this, I have a friend with that. So in between patients, I'll get on the computer. Before patients, after I'm done with patients, when I get home.
Beautiful. So we have a new one. We have a Reddit question.
Oh, my God, Reddit.
Stem
Thank you,
cell.
Reddit watcher.
Yes, thank you very much. So he said, I had a wrist injury where I ended up with a small ligament tear and a dislocated ECU tendon. Mm-hmm. Over time, it has developed into more pain up into my forearm and now tennis elbow. Just wants to know if stem cell can help this. He said, I've exhausted all other options over the past 3 years.
So whatever activity happened at your wrist over a long period of time, some people will have a little bit of wear and tear, It just gets worse and worse because a little shearing or tearing of the little microfibers in your ligaments and tendons and inflammation can occur over time. Other people have one injury where they fall or they get into a car accident and, injury and tears are created. When you look at stem cell therapy, the essence of stem cells, take those cells, put them right where the damage is. They'll absorb into the worn and frayed and damaged tissue and become brand new tissue, brand new fibers of ligament, tendon, muscle, cartilage and create growth and repair. They will decrease the inflammatory cascade. So for some people who have a swollen joint, knee, shoulder, whatever, wrist, swelling decreases, but then you start to have that improvement in the integrity of those ligaments and tendons. So, yes, and it's a great deal of research on that.
And then follow up.
How do certainly take a look at the website, by the way. So you could look at videos on stem cell therapy for all the different things that we do it for. Yes.
Yeah, I know you've definitely mentioned this before, but how do you target / control where the stem cells go?
So the best way to answer that, and I answer the same questions thousands of times as I've done in 35 years being on the radio. So there's no question that's not good. They're all good questions, and there's no question that we don't want to answer. We'll answer them 1,000 times, and I do. It's part of getting the knowledge out there. So the easiest way to describe this is that if you have an infection in your sinus or an infection in your toe, your teeth, your gut, the chemical messaging that your body creates, which is pretty vast and complicated, but really cool if you were to read about it, it's extremely complicated, allows antibodies, T cells, B cells, macrophages, all sorts, lymphocytes, all sorts of cells to go to kill something that's foreign and to kill this bad thing. And that's how your body normally fights infection. So it's the chemical messaging that creates that every millisecond of your life, and your body's constantly looking for places to go to kill things. Stem cells, in a slightly different but very similar way, respond to chemical messages for inflammation and degeneration. So if you're diabetic, and I extract your own stem cells from your body, it takes a minute and a half after we sterilize and numb the area. We spin those bone marrow cells, that liquid, for a half hour, high speed, extract the stem from the bottom of the centrifuge bottle and put that into your vein. It'll go all over your body like a train going all over the country. It'll find areas of damage and degeneration, inflammation, get off the train, set up shop, and create brand new cells of that damaged tissue, shut down the inflammation, and become new pancreas cells that make insulin. And now that pancreas is increasing in numbers and has the insulin it wasn't making as much before, and now you see changes in your blood sugar. And those cells divide like crazy. So the chemical messaging is really the key comment there, whether it's your immune system going after to do its job or your stem cells to go where they need to go. They know where to go. Another cool story, I don't know if I mentioned this, but I might have told you this, Frankie, but when I got the training in stem cells, got my fellowship certification, and we were interacting with a lot of the patients that were being treated, this and that. There was a patient who had significant blockage in their blood vessels going down their leg and their arteries. They did an arteriogram on the patient, and the lateral vessels were just blocked. One area that was the hub where you branch off for the rest of the vessels to go down the leg below the knee was blocked. And the doctors did stem cell therapy. They injected the stem cells, besides IV, to go to your blood flow, into the muscle going down the leg. And 3 months later, when they redid the angiogram, they saw that those areas, there were new collateral vessels that grew down to the leg, replacing the old ones that weren't working there anymore. So they know that stem cells from the IV get to your blood flow, but also injecting into the muscle, they migrate to where they need to go. And now that person, documented by a before and after angiogram, proved that the new blood vessels were made. And there's a lot of research on new vascularization with stem cells. Pretty cool stuff.
That's crazy. So we have another Redditor.
Wow.
Redditor.
Awesome.
Cryptic Planet 32 asks, I was wondering if anyone here or anyone that you've treated gets stem cells injected into their face for any reason.
Yes.
And then says, I've been having this problem with which every dermatologist I've been to has not been able to help and have said, there's nothing we can do. This problem has to deal more with physiological function of my skin. Yes, that's the question.
Okay, so not knowing what the physiological mechanism is, we have treated, and lots of people, we've treated for what you might call a cosmetic rejuvenation for their face, and why not? Because you're making it work on every other organ and part of your body. We do it for hair thinning and loss. So when you take the stem cells, the exact same mechanism, extract, spin, and you put them into these tiny little 1 cc syringes, much like what you would use for Botox, and you inject them through all of these different areas throughout your face, you're layering stem cells into your skin. And now those stem cells become skin cells. And now you have a layer of all these new skin cells coming up. So you're rejuvenating and making younger skin cells come up. If you're injecting into muscle, you're enhancing the muscle. So yes, you can do stem cells for facial rejuvenation. It's far beyond what people may try to get from a vampire facelift, which is just using your blood and using PRP to temporarily help, because stem cells will continue over the course of years. So stem cell therapy is one of the best things you could ever do for your skin. But I'd be curious as to see what sort of issue they told you have, and I don't know, they're maybe just making something up because they can't figure out how to give you the benefit you'd want. I've seen that before. Doctors, if they can't help you, they say, oh, you've got blah, blah, blah. And I look at the patient, I look at what the doctor's saying, that doesn't make any sense to me. So, anyway, we'd love to help you out. And for anybody, certainly, who's far away from the office, who have a hard time getting in, we do telehealth visits. So you could call the office, set it up, fill out the paperwork, etc. We give you a time. I'll sit there, talk to you on the phone, go over everything. We make recommendations to get your blood work done. And then second visit, we can go over that over the phone, so we can give you some pretty good guidance.
We're back to Instagram.
Okay, there seems to be a battle. Between the grammars and the tubers.
YouTube is sleeping a little bit.
We have grammars and tubers and talkers. So I think the grammars are winning the race.
I'd say so. We have, hi, Doc. This question isn't for me, but someone I know. She's a 31-year-old female who's been diagnosed with an extremely rare disease, NLSDM, neutral lipid storage disease with myopathy. She's been told there is absolutely no cure and is trying everything. Do you think there is any possibility
lipid storage disease with myopathy?
Neutral lipid storage disease with myopathy, yes.
I'd have to go back to the books and read up on that. But I'm inclined to think that if you're putting new cells into the muscles or into the blood vessels and you're getting brand new cells to go out and help to repair and decrease an inflammatory cascade and repair damaged cells, you'd have benefit, and that's what stem cell does. But that being said, I'd have to research the disorder again because I haven't seen, as most doctors have never seen or would never see that, but that's the sort of diagnosis that takes a while for doctors to try to figure out what's going on. And in part because there may be no medication specific to that condition. Traditional medicine doesn't have anything significant for that. But that will be something that I'll research today when I get back. And we'll hopefully have an answer for that on Friday's show. So if you call in and you ask, I will research it.
And just a reminder, office phone number, 516-794-0404.
That's right. Website, drcalapai.com. And as you can see, we love to talk to people and give them ideas and point them towards research and also at having a lot of fun. 888-420-9272. If you'd like to call in to ask a question or contact us, you can do so right now. A lot of good questions today.
Great questions.
We'll give people a little bit of time to connect. Let's see. One of the emails to the website out of many, John was asking about how long does exercise have to be to create a result. And I mentioned that at the beginning of the program. I would do a half hour of something every day. If there are times when you want to do an hour and a half, go for a long walk, long bike ride, great. I don't think you have to kill yourself. I don't think you have to do, 100-mile bike rides to get result. You don't. I have a very good friend of mine. I spoke to him today, Charlie, and he's a pilot. He's an attorney. He's a super busy guy. But just about every week, I'll see him out riding his bike, and he'll ride for 40, 50 miles at a clip. He just loves to ride the bike, and he does it. He's in terrific shape. He's physiologically probably 20 years younger than his age, but if you want to do that, that's great. But I say the very minimum would be a half hour to 45 minutes every day, because your body does so well with that fine-tuning mechanism. There's nothing like exercise to deliver nutrients, vitamins, minerals, and hormones, and also to get rid of waste products from metabolism and enhance your immune response. So everybody has to do it. Okay, let's see. We have another.
We got a question real quick on YouTube. Do stem cells help ALS?
We've done stem cell therapy on ALS patients and who've done better. It's not as though you can reverse or completely stop that mechanism from occurring, but in the patients that we've done a couple of treatments on over a few years, they've done better, and according to their doctors, have probably lasted longer. That's just one disorder that is such a powerful degeneration, and traditionally doctors just don't understand it, and that's why there aren't any medications that create result for it. But I think we could probably extend life for a time with STEM. That's one of those disorders that we don't have anywhere near enough understanding about.
We get another Redditor asking stem cells for POTS/long COVID dysautonomia.
Dysautonomia. So long COVID is, and the question would be, did the person have vaccines or not? Because vaccines can create more progression and, myocarditis and autoimmune and many different things that we know from research now. So where we were afraid to say that initially, literature supports that, even CDC and all over the world. So with our patients that have COVID, and they got over the initial hump, which for some people was really insignificant. Some people said, yeah, I felt crappy for a day, and then I was fine. But then they started feeling achy, tired, etc. We've done a lot of the vitamin IVs. Vitamin C IVs work really well because vitamin C IVs help to inhibit viruses. And you can see research on Google Scholar talking about vitamin C inhibiting shingles virus, Epstein-Barr, even with Epstein-Barr hepatitis, and COVID. So vitamin IVs work well with that. We've had a lot of patients that had COVID that had bad lungs before COVID, and lungs got worse during COVID. We've done stem cells on them. And you can see videos on my website of people that had stem cell therapy for COPD. Similar, exact same approach. You extract, spin it, you do an IV, and then you breathe a nebulizer with stem cells in the chamber of the nebulizer device. So you're topically putting them to the lungs. And for people that have assorted brain-related issues as well, we have stem cell therapy helping to repair the brain. So I think that would be an ideal recommendation for someone who has combinations of brain-related or neurologic or lung and other associated disorders and inflammatory mechanisms. So we've seen that with COVID patients.
Flipping the script a little bit. What's the difference between a prebiotic and a probiotic?
There are two slightly different mechanisms to help to stabilize and help your gut function. For many, many years, people used probiotics and did very well with them. Then the term prebiotic became more popular, and now a lot of gut-related nutrients are combinations of prebiotics and probiotics. There's one that I get from Whole Foods that's got magnesium in it. It's a great magnesium, and it's got prebiotic and probiotic in it. So I think they're both helpful to stabilize your gut and enhance your absorptive digestive ability. But just within that comment, we have to figure out what the gut's doing before just saying, oh, I have problems with my gut, I'm taking probiotic or glutamine or prebiotic. So I want to figure out what's happening first. If there's inflammation in the gut, you want to work on that. If there's inflammation in the gut because of a delayed reaction to a food, and a food allergy is causing inflammation, a person doesn't know it, test of the foods, get the food out, and all of a sudden you'll see your gut maybe working better. There are people that have gut issues that don't have allergy per se because the skin test and blood test don't show IgE antibody allergy, but may be allergic to the GMO component or chemicals in a food. So every time they have that food, we can track it. You know what? 2 days later, you have this, or an hour later, you have that. So I would look at the gut first, and then we could put together recommendations on things that will help the gut. So I don't want to be like the traditional medical approach that some doctors do. Here's your symptom, here's the drug. Here's the problem, here's the drug. I'd rather figure out the cause of the problem and change that. 888-420-9272 if you'd like to call in or contact us, you can do so. And we're getting questions from people all over the place today. This is awesome.
Yeah, we are. Someone's asking on Reddit, have you ever done any stem cell for autism, possibly? They're asking nonverbal 3-year-old child.
We have, although that I'm unable to see and treat 3-year-old kids. But I know stem cell therapy has been used for autistic kids. We had one who was 15 or 16 years old, big kid, bigger than me. And he did very well with it. He became more calm, he became more focused. But again, think of it. You're allowing brand new cells to go to your brain to make more neurotransmitters. And whether you believe in what's happening over time with these wonderful young kids, and you can understand what I'm trying to allude to, and you're going to see and hear a lot about this from RFK Jr., and I salute him. I've got to figure out a way to interview him for this program because I think he's a godsend. I think that what's happened over time is that repetitive exposures to chemicals from a variety of sources, but certainly within injectables, have created a great deal of damage. When I was a kid, how many injections? 3? Now they're trying to push 70 injections, 70. I'll leave it there, research it, understand it. I think it's dangerous, especially for a developing brain, to have way too much exposure to heavy metals.
There we go. And I've recently heard about taking a daily shot of apple cider vinegar may have health benefits, such as supporting digestion, weight loss, and balancing gut flora. Is there any truth to this, Doc?
So apple cider vinegar is acetic acid. It's an acid. So some people can't take that extra acid sitting in their gut because it may irritate them if they have a little bit of inflammation there in the first place. The whole idea, and this goes back many, many, many years, of using apple cider vinegar with some honey in it. And people said they thought it helped to decrease indigestion. Is it possible? Yes. It's not going to balance organisms in your gut just by putting an acid in there. Some people have the idea that taking alkaline or alkaline water is going to balance, but it doesn't. Because once you understand the pH of your blood and how your lungs and your kidneys work to keep your pH at 7.2 exquisitely every millisecond, you can take enough alkaline in to make your body alkaline for a millisecond or a minute or a day. So your body will always, if you're taking too much alkaline, keep acid. If you're taking too much acid, you're peeing out the acid. So although some of these suggestions really are not medically or scientifically substantiated, some people like to take that swig of apple cider vinegar and hope that it's going to do something. I'd rather look at digestive function. I'd rather look at allergy. I'd like to look at a whole bunch of things to really see what's occurring to then change that stomach symptom. Very frequently we see people have an allergy to a food that they had no idea about, and not everybody's going to react to a food within the minute that you eat the food, so it may take a couple of days, even for a week, for your antibodies to build up high enough to create a symptom. So I'd rather learn everything and then put together good common sense recommendations as opposed to like a shotgun approach where, something that's come from years ago and was suggested but has never been substantiated by research.
We have another Redditor.
Wow, we've got to thank all the Reddit people today.
We love it.
Reddit's coming on strong.
Yeah, we love it. So I was recently diagnosed with premature ovarian insufficiency. Little did I know that a dysfunction in ovaries would come with all sorts of horrendous/surprising symptoms that affect my daily life that bad, but more importantly, that it would affect my ability to have a family. I have had consultations with different clinics in the U.S. and Europe, but I'm really keen to know if there's any success with stem cells to regulate hormones and eventually being able to possibly conceive their own eggs.
Well, stem cells make brand new cells in all of your organs. So it would be likely that stem cells would know that there's a decline in ovarian function, just like they would know there's a decline in your pancreas function or your heart with heart failure, liver, kidney failure, lupus, rheumatoid diabetes. So all of the disorders that we treat, which people can see on the website, which are numerous, stem cells go to where there's damage and degeneration. So I'd be curious to see the testing that the other doctors did, whether here or elsewhere, and what their recommendations were for, ovarian failure. Is there some dysfunction where the ovaries are not getting enough blood flow? Is there potentially some heavy metal exposure causing damage to organs or hormones or neurotransmitters, in whatever disorder we're talking about? So I'd like to really understand more of what's going on and then start to make recommendations based upon that. I'm certain that other doctors are probably recommending hormone combinations or hormone therapy to try to boost up what is not being made, but I'd rather learn about everything and start from the basics and see if we can get that to, repair, more naturally, organically. Also, doctors don't really look at IGF-1, the active component of growth hormone. They don't look at DHEA because DHEA, if it's declined and you correct DHEA, it helps to make your own testosterone, a little bit of your own estrogen, progesterone. So I'd want to look at the whole hormone axis as well. I know I keep saying that, but literally, that's the most important part of understanding why you have your problem. You have to look at the cause. Once again, 888-420-9272. We're just about at 17 calls. Let's break 20 if we can. You can just call in to say hi if you want.
Please, please.
888-420-9272 if you'd like to contact us. If you like to listen, which I think you do like to listen because so many people are calling and we're getting huge numbers of people liking the videos on YouTube and TikTok and Instagram. I'm very fortunate that people like what we're talking about. And if you tell a friend or a family member, you're just getting out really good information to everybody else out there. So, and then those people call and ask questions. So I just, I've done this for the better part of 35 and now 36 or 7 years talking to people because after the radio program, when COVID came along and crapped out radio, I was always looking for something to be able to continue to talk and teach and help and learn and do all these things. And now we have a wonderful mechanism and we can see who's liking and who's watching and who's subscribing. We didn't really have that before on radio.
We just need YouTube to promote our videos.
Yes.
Then we'll be golden.
Absolutely. We're very close to getting all these things and reaching on whatever milestones they want us to reach. So we're close. So we ask for your
Got a caller.
For your help. Okay, let's go to a caller.
Hello, hello.
Hi there. How are you?
Hi. Good. How are you?
Great. How can I help you?
I wanted to ask Dr. Calapai if he thinks stem cell therapy would help somebody with complex regional pain disorder.
Yeah, we've treated patients with regional pain disorders with all sorts of injuries. So regional pain disorders, you have kind of crazy firing of your nerves giving you that pain. So there's some sort of inflammatory mechanism that's creating that. And even for people who have tears of ligament, tendon, cartilage, etc., the stem will go and create a decrease in the inflammatory cascade, but put brand new cells in where there's damage and degeneration. So I think it would be likely that, and again, depending upon the whole backstory of the pain syndrome, I'd like to understand first, but likely putting brand new cells in to create repair would make sense. How is the injury created?
Great. She hurt her wrist years ago. Dr. Chris, it's Karen Delaney. It's Joe's sister.
Oh, my God. How are you?
I'm good. How you doing?
Oh, wow.
How have you been for 40 years?
Yeah. Oh, wow. That's wonderful. I love Joe. He's one of my favorite people, one of my best friends. You know, we go out to dinner every month or so. We laugh and cry like idiots. We laugh so hard.
I love it.
Oh, that's wonderful, Karen. Wow. Yeah, so I'd like to
Yeah.
figure out what, the background picture is, and then see if we can create some mechanism of repair.
I'm going to let her know. It's a good friend of mine, and she's been through the ringer with it. So I just happened to go on TikTok, and I saw you, and I'm like, oh my gosh!
Wow.
So I'm gonna send her, your way.
That's wonderful. Yeah,
because she's,
we'd love to help her out.
Sounds good. All right. Well, It was nice talking to
Yes,
you.
you too. If you speak to Joe before I do, I'm going to call him today and tell him that we spoke.
I'm actually going out to dinner with him Wednesday.
Oh, great. Wonderful.
All right. Nice to talk to you, Chris.
Thank you so much. Good talking to you.
You take care.
That's great.
Bye-bye.
A blast from the past.
Bye.
Wow.
That was our first TikToker call.
Wow. Oh, wow.
Let's go.
First TikToker. We got to put a T next to that one. Terrific, terrific. All righty.
We got another one.
Calls to break. Another one. We're going to break 20.
Hello, hello.
Hey, got some questions on stem cells.
Yes.
One question. So I've seen some studies that if you do like IV Wharton's jelly, it doesn't get past the lungs and pulmonary pass.
Not true.
Is that right?
Nope, not true. Are you looking at autologous, your own stem cells, or are you looking at umbilical or amniotic fluid? Because umbilical is not your own, and your body may have a hard time dealing with something that's foreign. Number one, you could reject it. You don't know the genetics or the infectious history of some, donor. But we have patients with COPD the same day because we've done intravenous and we've done nebulizer to breathe topically to your lungs. It's a double approach that get phenomenal results. You can see the videos on the website. So your own stem cells, once they get into your blood, can go everywhere. Your body couldn't block your own cells from floating through your blood to get anywhere. So I'd be suspicious of research that said your own stem cells can't get to your lungs. It's not true. We've seen it. We've also had people that are diabetic and have had significant improvement, even reversal of diabetes, but we didn't do the nebulizer because they didn't have a specific lung issue, but said their breathing capacity and their lungs did better from the IV that we used for the diabetes.
Mm-hmm. No, I was talking more about like allogeneic, like other people, other like Wharton's jelly or other cells.
You're talking more about what?
Like Wharton's jelly or other cells, not autologous cells.
You only use your own bone marrow.
No.
We only use your own bone marrow. That's the only safe treatment to use because they're your cells. As I mentioned, people going and spending 4 to 5 times the expense and sometimes more, going to Mexico, Panama, Costa Rica. You don't know what you're getting if it's someone else's umbilical cord or amniotic fluid. You don't know the infectious history of the donor. You don't know their genetic issues. You don't know how long those cells are kept. How old is that cord? You don't know who's in charge of that, how many cells you're getting, how many die when it's frozen. I mean, there's so many unknowns that the government and the FDA won't allow that here. So I wouldn't, do that.
Okay, thank you.
Thank you for your call. All righty. Phone lines are open, 888-420-9272. We're going to break all barriers today, waiting for our 20th question, 20th call. That would be amazing.
Come on.
We'll give people a minute or so.
Yeah.
We're on a roll.
Let's
see what else. Another email. Someone was talking about hair loss, a gentleman. So as we get older, and this is separate from people that may have the androgenetic, genetic hair loss, your hair needs nutrients. It needs a lot of good things to grow. It needs hormones, vitamins, minerals. So a lot of people see changes in their hair. They don't think they can do much for it, but you can. You can do a blood test to look at all your vitamins and minerals, correct those. You can take some biotin. That might be advantageous. You should also use collagen peptides because those are good for your hair, your skin, your nails. If your levels of IGF-1, the active component of growth hormone, are low, then you're losing the ability to make your hair thick and strong as it did when you were making that IGF-1. So you correct that through using Simorelin or IGF-1. Other hormones that can play a role, thyroid. And we have a lot of women over time when they get older into their 70s and 80s, their hair gets very thin and their thyroid's low. You correct the thyroid, all of a sudden their hair starts to improve. That happened to my lovely Aunt Nina years ago, and she was thrilled to see that her hair was coming back to normal. And rest her soul, she lived to 99 and a half, I think.
Whoa.
And yeah, wonderful genes in my family. But yeah, there are so many different things that you can do. I will tell you that back in the day, and my mom's probably listening, hope she doesn't call in to yell at me because I'm going to tell a story about her and her brothers and sisters. My grandmother would take olive oil, warm it up, and comb olive oil through their hair. And, there are 6 kids, 2 boys and 4 girls. And I don't know how often, maybe a week or so, they would just comb olive oil into their hair, and their hair is phenomenal. My mom's hair is phenomenal. And she's very young, 95. She just turned 95 in November. So, yeah, there are lots of things that are great for your hair. There's a cap called Capillus, a baseball cap with a light that you can use that can help to stimulate your hair. So there are lots of different things that you can do. Even for some people, minoxidil, Rogaine foam. So it depends upon, how you present. So a variety of good mechanisms to help with your hair.
We got another one.
All righty.
We got 20th question.
20 today.
Is there a form of protein healthier than others? Like, is chicken better than steak? And is steak better than veal, lamb, etc.? I'm trying to eat more protein.
The best way to answer that is that if you're going to organic sources, that's always better. But non-organic, chicken may have 65 chemicals in it, and red meat may have 75 chemicals in it. So if you want to take it as a food, you want to get as organic as humanly possible. Your body really wouldn't know the difference between chicken, turkey, beef. You get some fat with some of the meat, so you may want to keep the fat content down. I like protein powders, so every day I wake up, I've got a great protein powder. It's called Orgain. I get it at Whole Foods, and it's organic plant protein. And I put a scoop of that in the coffee in the morning, put a scoop of the collagen peptides in. So I'm getting that, and that for me is a perfect breakfast. 21 grams of protein, the peptides, and I'm not hungry until, 2 or 3 o'clock. But the more pure, the better. And I like the protein powders because you don't get all the other wasted components like you might within foods. But, if you can get some good protein source from foods, organic chicken, turkey, fish is very easy to break down. Lamb, you can do that. So the question is how many grams of protein you want to take in per pound of body weight. Some people want to do it for bodybuilding, and they, use a huge amount of protein. Just got to be careful with that. So we really gauge that based upon your weight, your activity. Some people think protein is bad for your kidneys. If you go crazy with it, maybe, but typically in most, normal circumstances, it's not. So if you were to add another 21 grams of protein, steak compared to the powder is easy. It's absorbed right away. There's no difficulty absorbing it. It may take a lot of time to absorb a steak once you break it down, if you do break it down to its best form. So sometimes just adding that protein powder in once a day, twice a day is the best way to do it. Okay.
Not bad.
Not bad. 72 minutes, 16 seconds, 18 seconds and counting. Good show.
Great show.
They're getting better.
Oh, yeah.
All right, friends, thank you for listening, watching. Give us a call at the office, 516-794-0404. Take a look at the website, drcal.net. No, drcalapai.com. That was my old website, which was not a good website. drcalapai.com is the new and improved website with moving pictures and all sorts of cool things. Love you to listen to the podcast. Tell your friends and family about it.
Subscribe to YouTube.
Subscribe, to YouTube. We'd love to hear from you. We'll be on again live on Friday at 12:30 and again Saturday at 2:30. So we'll see you and talk to you then. Bye-bye. God